Udo Fuchs is a rare specimen, a young country doctor. He recently did what the German health minister wishes more well-trained and motivated young doctors would do. He took over a country practice in the state of Brandenburg.
The love of my life comes from the Oderbruck region. She's a vet and wanted to set up a practice here. So we decided to move to the region, and I took over a practice from a doctor. The doctor had been looking for a successor for 3 years.
About 22,000 doctors will be retiring over the next few years, and they'll need to be replaced. But why would anyone want to settle for working out in the countryside when they've spent 10 or 12 years studying?
I definitely don't want to be working as a country doctor when I'm 35. I really want to be a doctor, but I'm not so interested in research. I'll see what grabs my interest during my studies.
Anyone who studies medicine in Germany plans to go abroad. Who'd want to be a country doctor with all the laws and the poor pay?
But Health Minister Phillip Rösler has come up with a plan to entice more young doctors to the countryside. Attract more medical students by lowering university entry requirements. Address the shortage of doctors in rural areas by introducing incentives at universities. A certain number of university places would be reserved for students who commit themselves to working in rural areas later. But not all experts favor this approach.
The problem is not that we have too few medical students in Germany, but that too few of them go on to work as doctors. We need to put together a complete new package. These proposals alone are not sufficient.
As opposed to just joining an established clinic, opening a practice in the country requires a certain investment and involves considerable financial risk. Many experts are skeptical about forcing medical students to commit to working in rural areas.
New conditions and incentives won't necessarily create good country doctors. It takes a certain mindset which can't be created by signing a contract or offering incentives.
Until recently, conscientious country doctors, on call night and day, actually ended up paying for their commitment. If they treated too many patients and exceeded the health insurer's budget, they got their pay cut according to a complicated point system. But the system has since become more flexible.
This pay cut that resulted when a doctor worked extra hard has been done away with. So a busy country doctor can rely on a specific salary that has nothing to do with points. He therefore has the option to take in a partner to share the workload, so he doesn't fall over and die as the richest person in the village at the age of 55. Dr.
Fuchs is still hard at work, even though his office hours are long over. Being a country doctor requires patience as much as medical expertise. Have you ever regretted moving here?
No, I haven't. Thanks to my wife.
And not thanks to the politicians. They still have to come up with a few good ideas if doctors like Udo Fuchs are not to remain few and far between.